Welcome to your daily dose of the social show. My name is Viwe Kyolwana, and I don't know if to say Happy World Day today, but I want to say I'm celebrating with everybody who has and is going through the disease or has family members who may be diagnosed. I'm just saying I'm with you in solidarity. This is the social show, of course, and we speak all things CSI, CSR, as well as CSV. It's been a minute. The flu has had the best of me, but we're not down and not out of the count quite yet. Of course, if you want to just speak to me a little bit about your initiative, your idea, whatever it is you're going to do, you're thinking about doing in the NGO space, NGO sector, or an initiative you're starting today for AIDS Day, World AIDS Day, please don't be afraid to send me a tweet at Brand Live Radio, or you could just email me at press@social-tv.co.za, and I will definitely send you the shout out, or perhaps get you on the show to speak a little bit about your idea. All we want is new ideas, new concepts. We want to move forward to a better South Africa. We want to make sure that the NDP goals are eventually realized, and that is not done without the help of normal South Africans and everybody else who is working in the space. Of course, the corporates at the pinnacle of it all, because they do provide funding. But as usual, I'm going to start off the day with the news. With over 4,000 men diagnosed with prostate cancer annually in South Africa, the Movember Foundation, best known for its hairy efforts to raise awareness and funds for its often ignored men's health issues, will extend Ironman, its global prostate cancer registry, to South Africa. New treatments and therapies are on the rise, but there is a lack of understanding which treatment and care practices deliver the best outcomes for men with advanced prostate cancer. The Ironman registry collects information about a man's type of prostate cancer, their treatment, and what side effects they may be experiencing. In other news, the mother city's water crisis has reached dire straits. The city has found itself in phase one of critical water shortages disaster plan, and the level 5 water restrictions are officially in place. And as the city of Cape Town water officials work tirelessly to avoid day zero, the Western Cape Town hotel on the Cape Town's International Convention Centre's precinct has been making water smart efforts, which have resulted in at least 1 million litres of water saved a month. Western Cape Town's General Manager Leon Meyer says his establishment has joined calls by key industry role players, including the City of Cape Town, the Federated Hospitality Association of South Africa region, to save as much water as possible. And while the 1 million a month reduction when compared to the same period last year is a step in the right direction, there's definitely much more that needs to be done. To prepare for the day the taps run dry, Cape Town Mayor Patricia de Lille last week asked that when the time comes, the South African Police Service as well as South African National Defence Force be on the standby at the collection points to ensure residents' safety. Day zero has now moved from March 2018 to May 2018. And lastly, in our news, Pravin Gordhan, the former Minister of Finance, has been anointed as a visiting professor in the Wits School of Governance as from the 1st of December. Dean of Faculty of Commerce, Law and Management, Professor Imran Valadia, concurs that this is a substantial appointment that will bode well for the faculty. Mr. Gordhan will join the likes of Nhlanhla Nene, Interim Director of Wits Business School, Max Sisulu, as well as Tito Mboweni, all who have held leadership positions in government. This is another step forward in strengthening the faculty's cohort of stalwarts whose knowledge, energy and experience will no doubt inspire the next generation of leaders. And that concludes our news for the day.
Have you ever thought about the power of social media? Social media has the power to make your business grow. Yeah. Why don't you let us manage your social media? Because our business is to see your business grow. Visit us at www.bstownmedia.co.za.
My name is Andrew Lowndes. I'm the UK and Ireland Sales Manager for Presslit Care. At Presslit Care, we're very passionate about providing access for people with physical disabilities. And we're very passionate about the Changing Places campaign that provide larger accessible toilet and changing facilities. It's fantastic when we can see the smile on the faces of users. That's our reward, is to see the satisfaction and the enjoyment that people have.
You're back on the social show, and of course today is World AIDS Day, and I'm sure you woke up and understanding the consequences and the ideas that come out of celebrating such a day, or even just recognizing it, and also just maybe you're aware of what you have or have not done in your life to prevent infection, to prevent people getting dying because of just stigma. How has your reaction to the HIV/AIDS helped somebody, understand the virus a little bit more, understand it's not a death sentence, understand that, we can still live and be okay and work and be, productive citizens with the virus. Of course, a lot of different things have come out of South Africa, of the world, that have tried to prevent the HIV virus from spreading. You've got a lot of vaccines that have been tried and tested. You've got, just a lot of different methods to help deal with the situation. And of course, today we are going to be speaking a little bit about that. And of course, particularly in South African context now. In 2016, it was recorded that about 7.1 million people are living with HIV/AIDS in South Africa. 7.1 million, of course, and 18.9% of them are adults. And there's about over 200,000 new HIV infections every single year. Out of that over 270,000 people who are infected, about half of them are, half of the AIDS related. Half of them die of HIV and AIDS. 56% adults are on antiretroviral treatment, and 55% children are on antiretroviral treatment. And of course, this was only in 2016. I wonder what has been happening in 2017, of course. Now, South Africa obviously has the biggest and most high-profile HIV epidemic in the world still, with an estimated, as I said, 7.1 million people living with HIV in 2016. A lot of progress has been, set, especially towards adults aged 15 to 59. That's what people are trying to get with the 15-year-olds, the younger generation, not to get the HIV/AIDS. So what has been happening now is they've increased awareness of the HIV status. So people are more aware of what it is that they have or have not. People are testing regularly. People are going to the clinics. About 86% increase of awareness. However, what has also been shown is that there's been a 65% increase on treatment. So of the 86% number of people that are now being more aware of the HIV status, about 65% of them are on treatment and are getting the right antiretrovirals, the right advice, the right just the right support to help them with the disease if they have it. And of that 65% that is getting some sort of treatment, 81% of them have been virally suppressed and are living normal, healthy, clean lives. And that is the most important part, I think, to really regurgitate today. We're not talking about HIV as how we used to speak about it back in the day, where we would think, if you have HIV, you're dying tomorrow or you're dying in a few years. We're talking about it with a bit more, positivity to say, the virus exists. Yes, there are a lot of things that have been done to help suppress and prevent. However, if you do have it, and if you have gone and gotten your test, it is not the end of the world. It is definitely suppress it. You can suppress it. You can live for long. You can have a normal, healthy life, and it will not necessarily change anything. The only big thing is that the stigma. Of course, we'll talk about that a little bit later. Now, HIV prevalence among men who have sex with men, MSM, and HIV, sometimes referred to MSM in South Africa, is now estimated at 26.8%. HIV prevalence among men who have sex with men varies geographically, but is reported to have risen by more than 10% in Johannesburg. And I assume it's the same, perhaps, or a little bit less with women and women. It's very important that we also have to, guide people, because the stigma around people who are, gay or lesbian or, engaging in other forms of, sexual activities, there has been, a stigma around that. And then on top of that, there's a stigma around HIV. So when you combine those two stigmas, it's very difficult for people who are, gay to get the right, treatment support. Many men who have sex with men still face high levels of social stigma and homophobic violence due to the traditional and conservative attitudes. As a result, men who have sex with men find it difficult to disclose their sexuality to a healthcare worker because it limits their HIV, their access to HIV services, which I think is horrible, the most horrific thing. However, there is evidence that the attitudes are changing, and quite recently in a study, it found that 32% of South Africans said homosexuality should be accepted by society. Of course it should be. This was only in 2013, and now of course we are working towards less discrimination against people of all different sexualities, people of all different colors, and obviously the gender bias that has been existing in South Africa at the moment. However, we have to find new ways in which we speak about HIV and AIDS. And a lot of times I've had Love Life on the show. They've spoken about their new rebranding, re-understanding of sexuality, and not only understanding condoms as a preventative to AIDS, but understanding that safety first, putting yourself out of harm's way means these are the tools that you can use to prevent anything from happening. And I think a lot of the time we like to think or like to use safe sex just for HIV and AIDS, but it's literally like for every single thing. There are so many different things you can get. So I think there are a lot of different companies and corporates who are coming together to rebrand and re-strategize how they're going to be telling young people how to stay safe from every single thing. Because remember, HIV and AIDS is not life-threatening. So is, in any other sexual disease that you might get, but we need you to not to get it, regardless of whatever it is. So it's very important that I think more corporates get into this space and lead the role in improving HIV access to services for all different kinds of people. But more than that, also understanding that HIV is just only one of the things you could get, so you just need to be safe in general. So it's very important. Nationally, HIV prevalence among sex workers has been estimated at 57.7%. And although this varies between areas, with prevalence estimated at 72% in Johannesburg, 54% in Durban, and 40% in Cape Town. In 2010, actually, sex work accounted for an estimated 19.8% of all new HIV infections in South Africa. So sex work has contributed to the highest way in which you can account or you might access HIV and AIDS. Female sex workers are particularly affected, with studies finding HIV prevalence among this group to range from 40% to 88%, significantly higher than among women in the sort of general population, which is 14.4%. In particular, young female sex workers under the age of 25 carry a heavy HIV burden, highlighting the need for focused interventions for sex workers from an early age. Now, a while ago, there was a big debate around legalizing sex work in South Africa. And for a while, I was a bit, I had my own personal 2 cents about the content, what I thought about legalizing it. But when you think about it from a legal perspective, and a way in which sex workers, who of course have chosen that as their means of making money, and how they just don't get any access to any health services, regardless of whatever it is. If you are known as a sex worker in your community, going to the clinic, nobody's is really working to help you. So I think legalizing was one of the ways in which we can prevent these young women from not dying from HIV and AIDS, getting access to antiretrovirals, and also getting access to medical care. And I guess that's still up for debate, and you can definitely let me know at Brand Live Radio what you think about legalizing sex work and what it will do for the HIV epidemic. Because again, if they're saying that the highest number of infections come from sex workers, and we're also saying that sex workers under the age of 25 aren't necessarily accepted or have access to HIV prevention, HIV cure, not cure, obviously, like antiretroviral, sorry. We're also saying that we're trying to fix a problem that we're being counterproductive. So it's quite a good I think it's a good thing to start thinking about when you think about young women and especially within the sex working space. Although South Africa is moving towards decriminalizing sex work, carrying condoms can still be considered an offense. And in 2016, UNAIDS reported that 86% of female sex workers reported using a condom with their last partner. So, I think it's very important that we start, looking at these issues, looking at these marginalized groups that aren't getting the right access to the HIV, antiretrovirals and so forth. And we start making sure that our clinics and our hospitals and the spaces in which we feel safe and we get health and we get medical reviews, everyone of any descent, whatever background they come from, are helped without any stigmas attached, without any bias, without anything. They just helped because they need the kind of help that they need. So I think there's a lot of work that needs to be done in our clinics, in our hospitals, in our medical centers, to make sure that whoever walks into that door gets, adequate treatment, regardless of what work they do, what sexual orientation they, succumb to, who they sleeping with, who they're not sleeping with, what race they are. It doesn't matter what LSM they're coming from. What matters is that they get the right treatment. And I think once we start ending the stigma and ending that isolation, we can eventually end the HIV transmission. And because people will then start thinking about, being stronger, being more capable, and being more feeling like they have agency over whatever sort of life that they choose. It's very important that we, as we go as a community, we help fight HIV, we end it. So I really hope that you are doing something this World AIDS Day to join the fight and to end the negative impact of HIV. It's one thing to end, the actual virus and transmission, but it's another thing to end the negative impact that it has on families, on family members, on those affected and, infected. We need to see a culture of understanding, because what happens is that a lot of people die not because of the actual virus. They die because they can't take their antiretrovirals because they looked at a specific way. I know a number of people personally who have died of the HIV virus only because they didn't want people to know that they had the HIV virus, and that says more about our society than it does about them. For more than 100,000 people living with, the more than 100,000 people in South Africa, 7.1 million people, I think ignorance and discrimination is the biggest limit to opportunities and preventing people from living their full and happy lives. And HIV usually means that you're more likely to live in poverty and more likely to live in poor mental health. So I think it's very important that we bring a new burst of energy to end the stigma, to end the transmission, and to end isolation experienced by people with HIV for good. And that means we stop talking about it like it is the big elephant in the room. If you've got HIV/AIDS, it has to be easy you are allowed, you can speak about it or not speak about it at your own discretion, but I think when we take away the power from the word and we take away the stigma from the word, people are able to disclose and the people are able to live their lives a little bit fuller, a little bit more, with a little bit more, gusto. Now, as we know, World AIDS Day takes place on the 1st of December, which is today, and is also an opportunity for people worldwide to unite in the fight against HIV, to show support for people living with HIV, and to commemorate those who have died from AIDS-related illnesses, which was founded in the day was founded in 1988, and World AIDS Day was the first ever global health day that was ever announced, and I think it's very important. Today there have been a few, as I said before, advances that have been made in HIV treatment. There are no laws to protect people living with HIV, and we understand, but we understand so much more about the condition now. It's very important that we remind the public and the government that HIV has not gone away. Just because we're not seeing those Love Life ads, we're not seeing more news broadcasts on people dying with AIDS. I remember back in the day, you'd if somebody died of AIDS, it was news, and now it's no longer in that space. There's still a vital need to raise money, increase awareness, and fight prejudice, as well as improve education around HIV. Because remember, as we as we grow, as we move on, we have a new generation constantly coming up, and they need to know that there's no stigma attached. There's nothing the only thing that will kill you is thinking that is not, you know, taking your medication and not living a healthy life. So I definitely think a lot of strides have been made to increase awareness and to fight prejudice, and I think we can do more. And I really hope that you are thinking about what you're going to be doing, what initiative you're going to have in the 16 days of activism to also just jump in and say, you know, how can I help people or children who are affected or infected by HIV and AIDS? And I really hope you can share that story with us on social, -tv.co.za. I'm going to take a short break and I'll be back after this.
You're listening to brandlive.co.za, an industry first in the world of internet radio. Not only are we an internet radio station, we are an internet radio platform for your brand. So why not expose your brand to potentially thousands of listeners and improve your customer relationships and brand equity with podcasts and live broadcasts? Be sure to check brandlive.co.za for more information. brandlive.co.za, harnessing the power of internet radio.
My very favorite part of the show, things to remember. Now, what we do at this stage of the show is that we just try to remind you of something that you may have forgotten, something that we think would change your day, and I hope this message coming up will do something to you.
The vast majority of HIV/AIDS cases are happening in countries where daily life challenges are high, but access to health care is low. Imagine life without the shadow of AIDS. Imagine that family that's able to devote their energy to raising their children, to building businesses, to contributing to their communities. That's a much better world for all of us to live in. We have had major advances in HIV treatment and prevention thanks to decades of research as well as committed donors. But a vaccine is needed to bring an end to HIV/AIDS once and for all.
We would be able to relegate HIV to history, just like we've done with smallpox. That's the promise of a vaccine, and that's why we need to ensure that people are aware that this is what the real end game is about.
We learn more about HIV every day. The tremendous discoveries we've seen over the past few years are bringing us closer and closer to a vaccine. We thank you for being part of our quest to bring an end to AIDS. Please continue to join us in this partnership to truly rid the world of HIV/AIDS.
I couldn't echo the sentiments any louder to say we truly need to end the AIDS epidemic. Not only is it affecting the countries with the worst of conditions, but it also is affecting the families who just want to raise their kids, just want to make sure that their kids are safe and their kids are have a future. So it's very important that with the knowledge that we have, with the awareness that we have, that we start breaking down the biggest barrier, which I again think is the stigma. It can't be easy for anybody with HIV/AIDS to have HIV/AIDS, but it really can't be easy for them to have preconceived notions and stereotypes put upon their lives, put upon their the ideas of them, and just making their lives even harder than it already is. So on this World AIDS Day, I really hope that you focus your energies in really trying to eliminate the stigma, whether it's in your office, whether it's in your friendship circle, whether it's in your family. If there's family members, whatever the case may be, include them. Make sure they feel as normal as they have been, because it is not a death sentence, as I said before. And that concludes our show for today. It's been amazing. It's a beautiful Friday. I'm so looking forward to the weekend, and I really do hope that you have a wonderful World AIDS Day, and I hope you learn more, you do more, and you do something for someone. I hope you understand a little bit more about your country, and you understand a little bit more about the people that are suffering, and you play your part in whatever way that you can. We'll be back again, same time, same place, only on The Social Show.
Making a bold statement yet blending into the surrounding suburbs of Melville, 27 Boxes is a realization of edgy design and practical implementation. A radical departure from the shopping malls of our generation, yet not a return to the high streets of our youth. 27 Boxes showcases the best of a shopping centre set in a garden, surrounded by the bohemian suburb that is Melville. 27 Boxes, shop, play, eat.